Welcome to another edition of #Unplugged. My name is David Chin from CIO Academy Asia. Today on this edition, we are going to discuss the topic on enabling healthcare at the front lines with mobility. We are joined by esteemed tech practitioners, starting with Alvin Lin, Group Technology Director, Fullerton Health, Bruce Leong, Director, Technology and Strategy for Mount Alvernia Hospital, and last but not least by Nathalie Duchemin, Regional Strategy and Business Development, Mobile B2B for Samsung. Welcome everyone to the panel. Now, to kick off this panel interview, I will start off first with Alvin. The hot topic over the last 2 years has been the healthcare response to the global COVID-19 pandemic, right? And of course, it's a global challenge to find enough healthcare workers, equipment, and supplies to meet the needs of patients. We are very glad now that the global pandemic has slowed down and we see some level of normalcy, but many are keen to know how exactly has the healthcare sector responded to the pandemic, and also what digital technologies were used, especially in the area of enterprise mobility, to serve the needs of the people during this difficult time. Maybe Alvin, I give the floor to you. You can share your thoughts. Go ahead.
I would like to separate our responses into two areas. One is the internal users. How do I help my internal users and also my external users? So the internal users is mainly all the healthcare staff, the clinic staff, the doctors, right? So it's providing the remote access, right? Because everyone will be working from home and everything. So, and then you have to make your application to be highly mobile, adaptable, because now the call are generated from homes and we have to do house visits sometimes, right? And people are very mobile, right? Yeah, and yeah, rightfully to say about security, right? So we have to register all these devices to our MDM and MEM as well. So it's a lot of team scheduling, a lot of things for the internal. Whereas for external, you know that we are involved heavily in vaccine centers, swab centers, quarantine centers as well. So very shortly time, right? It's a good collaboration between the suppliers, the entire logistic chain where involved the telcos, the providers in terms of laptops and mobile devices, the switches, routers, and also MOH and IHEs play a very important part of that.
I will quickly head on to Bruce. Patients are also nervous about going to hospitals where they know, hospitals are used as treatment centers for the virus. What challenges do you face in terms of enabling patient care and making sure that the patients are still able to get the care they need, whether it's at the hospital itself or remotely? You want to elaborate and share your thoughts?
Healthcare is by nature a high touch point kind of industry. We need admission, we need patients be admitted in the hospital. A lot of cases are still inside. During the circuit breaker days in 2020, when I announced circuit breaker, actually, same as Alvin, we have very little lead time to reconfigure the whole work structure, in the sense that we do have to send a fair bit of staff home to work from home. Then comes what they call doctors' movement restriction between different institutions.
Mm-hmm.
Before that, doctors used to be able to travel from hospital to admit patients. They can access to patient data on premise in the hospitals. With this doctor's restriction, we are quite so-called blessed or lucky that mobility has already been planned for the clinicians and doctors, right? A nurse in the hospitals could call the doctors and the doctors can confirm on this kind of medication, but the clinician cannot travel all the way to the hospitals and confirm and talk to the patient as well. So mobility on tablets, on mobile devices, on how to remotely and securely accessing a patient's data, that has been done and tested and rolled out and enabled for even more clinicians. The need for that had not been strong before COVID, because they can still come to the hospitals and check on the data. But with COVID and doctors' movement restrictions, the need just skyrocketed, and then we have to scramble and provide secure remote access for the clinicians on our patients' data. We also have, we do provide some services like dietitian services to nursing homes and so on and so forth, right? Before that, Singapore is a strange culture that they still want to see the dietitian face to face. I can advise you on the dietary needs and so on and so forth. The disruption we see is enabling. We see is that, well, the parties are now, I kind of have no choice because they are preventing cross-institution movement. You have to resort to telehealth and teleconsult to conduct those sessions, even down to choosing and advising on the other institution, what kind of mobile device you should use, what kind of connection do you secure, or those kind of things are the disruption that we are seeing.
Thanks, Bruce. So Nathalie, share with us your observations in the healthcare sector in Singapore and beyond our shores. What has really driven the digital agenda, and how is mobility part of the agenda?
Definitely. I mean, I can just pick up some of the points also. I mean, we saw the weakness and the needs to respond quickly. I mean, it came with surprise. So that's where mobile plays the key role, because it's easy and fast to implement. So the speed of implementation is really key, and the scalability, because the pandemic took a huge a size which we didn't expect. So you needed to be able to scale quickly. And that's where mobile was key. So if you look at the COVID vaccination solution management, we worked in Thailand with a solution partner where we helped to implement it and make sure that the COVID-19 vaccine was delivered to all state hospitals in the country. And you have to track it and you have to trace it. So that's where mobile plays a role. But then also, I think some weaknesses we saw also this adaptation, what Bruce just said. So we adapt now, telehealth, remote monitoring is for the government, for the patients, for the healthcare professionals. It's something we do now. So before it was face-to-face, I was not comfortable personally. Also, I preferred to be face-to-face with the doctor. I tried it out, telehealth, so it works very well. And so I think this will stay. So it's something once you try it and it works, so it will definitely stay and help to decentralize a bit the healthcare system and help with some weaknesses. The other thing we see is, of course, the capacity of the hospitals. I mean, we have limited beds, and there are not only COVID patients, there are other patients who need urgent services. So we also need to think of them. And so that's where then telehealth comes in and also helps to decentralize. So in Australia, a great example, South Australian government implemented the telehealth COVID platform. So the patient who were at high risk could use it and stay at home, or can still use it. They just implemented it. And we also have in Australia and Vietnam, remote monitoring solution, because if you think of patients who just did an operation, heart operation, maybe they're sent home, so you need still to monitor the vital signs. So to lower readmission, which is also comes with a cost for the hospital and insurance and all the ecosystem, you do remote monitoring with using our wearables, for example, for vital signs, or different tablet solutions. So I think a lot of weaknesses shown, but a lot of opportunities and adaptations also, which will help us to have a better healthcare system in the future.
Thank you so much, Nathalie. My main takeaway from this panel is that the mobile technologies, connectivity, new collaboration tools have really come into the fore over the last 2 years, and as the panelists have said, have benefited the community and the beneficiaries in many ways, beyond just patients themselves. Medical staff, next of kin, visitors, friends have all benefited from this, and this momentum will continue to drive the digitalization efforts within the healthcare industry. So thanks very much to Alvin, Bruce, and Nathalie for sharing your practitioner insights and thoughts. We hope you enjoy this edition of #Unplugged, and check out the other editions on our YouTube channel and website, as well as LinkedIn. Thank you.